There are two ways to replace a tooth. Traditional solutions, like a tooth-supported bridge, involve grinding down adjacent healthy teeth to support the bridge. Unlike a natural tooth, the artificial tooth is not directly attached to the jawbone. The bone region directly underneath the artificial tooth is no longer affected by the pressure generated by chewing. Without that pressure, the bone region deteriorates over time. The overlaying gums deteriorate as well. As a result, a gap between gum and bridge will be clearly visible. A dental implant is the optimal solution for anyone who is missing one or more teeth. The implant feels and functions like your natural tooth root. Anchoring dental implants in the jawbone stimulates bone tissue and gums, ensuring an attractive, long-lasting, aesthetic result. If you opted for the implant solution, Step 2 includes an X-ray and scan of your teeth, gums, and jawbone. This is how a digital model is created, which perfectly matches your individual anatomy and forms the base for the design of your implant-supported tooth. After the appointment, the correctly sized implant is planned and positioned to replace your natural tooth root. An intermediate component, the so-called abutment and the crown, are designed to harmonize perfectly with your natural teeth. An individual, so-called surgical guide is designed to accurately convert the digital design into reality. The surgical guide is designed to fit over your teeth so the implant can be placed into the exact planned position. All of the customized components required for an accurate and safe treatment are produced and arranged in your personal Essença box in preparation for your third step. During Step 3, the surgical guide is attached to your teeth. The bone is prepared for the implant. And the implant is inserted in position exactly as planned. A temporary abutment and a temporary crown are put in place. During the healing phase, the implant is completely integrated with the bone tissue. Innovative technology and a growth-activating surface provide for secure and quick healing. Ask your dentist about your personal healing time. Once healing is complete, the temporary abutment is replaced with a permanent one during Step 4. Your new tooth is now in place, feeling and functioning like a natural tooth.